Hello everyone, welcome back to the channel, where we break down important facts and real-life topics that matter. Today, we're talking about something that affects millions of Americans, Medicare. And before you say, ugh, insurance talk, boring, stick with me. This is a big deal if you or someone you love is 65 or older, or getting there soon. This is a part 1 of a 2-part series where I'll explain everything you'll need to know about Straight Medicare, also called Original Medicare or Traditional Medicare. Then in part 2, we'll dive into Medicare Advantage, the private insurance alternative. By the end of this series, you'll be able to confidently decide which plan makes the most sense for you. I've spent about 15 years in the healthcare industry, working with direct insurance and patient care as well. And I've seen firsthand how confusing and frustrating this stuff can be. My goal is to make it simple, clear, and dare I say, maybe even a little fun. All right, let's jump in. What exactly is Straight Medicare? First, let's define what we mean by Straight Medicare, also called Original Medicare. It's the traditional federal health insurance program, primarily for people 65 and older, though some younger people with disabilities also qualify. Medicare Part A is hospital insurance. Think of Part A as your hospital insurance. It covers things like inpatient hospital stays, including overnight stays. It covers skilled nursing facilities, but not long-term nursing facilities. It covers hospice care, some health care as well, home health care. Now, one of the biggest misconceptions is that Medicare covers long-term nursing home care. Well, it doesn't. It only covers skilled nursing care for a short period after a hospital stay, like if you need rehab after surgery. Most people don't pay a monthly premium for Part A if they or their spouse worked and paid Medicare taxes for at least 10 years. But it's not totally free. There are deductibles and copays, which we'll get into later. Imagine this. You're 67 years old. You're visiting the doctor for a routine checkup. Under Part B, Medicare covers 80% of the approved cost, and you're responsible for the remaining 20%. If you're hospitalized, heaven forbid, Part A kicks in, but you might still owe deductibles and co-insurance. Sounds simple enough, right? But here's where things get a little tricky. There are gaps in coverage. That's why some people opt for additional insurance, like a Medigap plan, also known as supplemental insurance, like AARP, for example. Medicare Part B, B as in boy, medical insurance, while Part A covers hospital stays, Part B covers everything else you'll typically need on a day-to-day basis, like for, say, doctor's visits, including specialists, outpatient care, meaning urgent care, laboratory tests, x-rays, and other imaging you might need, like MRIs or CAT scans. It also covers preventative services, like flu shots and screenings, medical equipment, like wheelchairs, walkers, and even CPAP machines. Some home health care services as well. Part B has a monthly premium. Now, in 2024, the standard premium is $174.70 per month, but it can be higher for people with higher incomes. One of the biggest downsides of Straight Medicare is that it doesn't cover everything. There are gaps in coverage. That's where this Medigap program, also called a Medicare supplement, does come in handy. Medigap is an optional extra insurance policy that you can buy from private companies to help cover costs, such as deductibles. That's the amount you pay before Medicare starts covering. Also, coinsurance, that 20% of costs you're responsible for under Part B. It helps with copays. Those are fixed amounts. You pay your doctor visits, hospital stays, etc. There are about 10 different Medigap plans labeled with letters. So like Plan G as in George, or Plan N as in Nancy, etc. And each covers different things. But they all work alongside Straight Medicare, not as a replacement for it. One important note, Medigap does not cover prescription drugs, which brings us to something really important. So Part B only covers 80% of those approved services that we discussed earlier. That means you're responsible for the remaining 20%. And there's no cap on how much you might owe. That's where the supplemental insurance comes in. So Medicare Part D, as in David, covers prescription drugs. Medicare Part D is a separate plan offered by private insurers to help cover the costs of prescription medications. If you're on Straight Medicare and you don't sign up for Part D, you could face late enrollment penalties. Unlike Medicare Advantage, where drug coverage is often included, with Straight Medicare, you do have to choose and enroll in a Part D plan separately. So what does Straight Medicare cost? Well, let's talk numbers, because we all want to know, right, what we're actually paying for. So Part A is usually free, but if you don't qualify, it can cost up to $505 a month. Now, this is for 2024. Part B, as in boy, is the standard premium, is $174.70 a month, but it's higher for higher earners. Part D varies by plan. Usually it's around $30 to $80 a month. And the Medigap plans that we discussed earlier, they widely depend on the plan, but it could be anywhere from about $50 to about $300 a month. And remember, Straight Medicare doesn't have an out-of-pocket maximum like commercial insurance does, meaning United Healthcare's, Cigna's, Blue Cross Blue Shield's, etc. That means if you get hit with a major medical expense, there's no limit how much you could end up paying. This is one reason some people choose Medicare Advantage instead, which we will cover in Part 2 of the series. So what are the pros and cons of Straight Medicare? Well, a pro, nationwide coverage. There's no network restrictions. You can go to any doctor or hospital that accepts Medicare. So it's the freedom to choose additional Medigap plans and Part D plans. That's also an option. So the cons. There's no cap on out-of-pocket costs unless you have a Medigap plan. There's no built-in dental, vision, or even hearing coverage. Must manage multiple plans separately. All right, well, that's a wrap on Part 1 of our Medicare deep dive. Now you know what Straight Medicare is, how it works, and what it covers and doesn't, and the costs involved. So again, Straight Medicare isn't the only option. In Part 2 of this series, we'll explore Medicare Advantage, which is a totally different way to get your Medicare benefits, often with extra perks like dental, vision, and out-of-pocket maximum. But is it really the better deal? Well, you'll have to watch Part 2 to find out, and I hope you do return. I hope you found this helpful. Please like and subscribe and turn on notifications so you don't miss the update. And let me know in the comments, what's your biggest question about Medicare? And I'll do my best to answer. Thanks for watching, and I hope to see you in Part 2. Take care of yourself.